for joining us today. We are with Lauren Morris at Revitalist in Knoxville, Tennessee. Lauren has joined our company as an acupuncturist. Lauren, we would love to hear from you how you got into acupuncture and how it became a passion for you.
I've always been interested in health and the human body, and I've had a gravitation towards that. I was exploring different options to do. I love the natural, holistic approach, and a friend had mentioned acupuncture. It really helped her dad, who had been in a farming injury, and I started looking into it at the time. I was planning on moving to San Diego anyways, and there happened to be a really wonderful school right by where I was moving, so I checked it out and just fell in love with it.
That is fantastic. So can you tell us a little bit more about what is acupuncture?
So acupuncture is a modality within Chinese medicine. Chinese medicine is the oldest practiced medicine in the world. It dates thousands of years back. And so within Chinese medicine, there's acupuncture, cupping, gua sha, tui na, and herbal medicine. I practice all of those. Cupping, gua sha, and tui na are actually soft tissue techniques. And so Chinese medicine is wonderful because it looks at the person as a whole. It looks at the person within their environments. And so any condition that we treat, we will never just treat the one specific thing. We'll treat the entire body together. And so I can treat 5 people all with insomnia, and I treat each one of them differently because we really look at the patterns and understand the person. So Western medicine might view the person as more of a machine, and this one part is broken, where Eastern medicine would look at it as a garden, and so this one area might be dry, it might need more water brought to this, or less sunshine or more sunshine, and really seeing the body with different patterns and treating based on those patterns, which is a really elegant way of going about it.
That's so interesting, Lauren. Can you tell us a little bit about, does it hurt?
Yeah,
I think people want to know.
I hear that question a lot. So it does not hurt. Sometimes you might feel a little sensation, and that's actually the nerve responding. So we're learning more and more about the biomedical understanding of acupuncture and how it works. And we're learning that a lot of acupuncture points follow nerve pathways. And so you might feel, it's not like a nerve, like a painful nerve, it's just a slight ache or pinch. Sometimes people feel nothing at all. I've had patients that are snoring before I'm even done needling them. That's not uncommon. So it's surprisingly relaxing and people really enjoy it.
Interesting.
Yeah.
Could you elaborate a bit more on some of the conditions that you have successfully treated?
Yeah, so because acupuncture has been around for so long, it can kind of treat a little bit of everything. There's certain areas where it really excels at, and that's pain, women's health, neurological, mental health. I've seen a lot of anxiety, depression, addiction. I treat women that have maybe painful periods or infertility, and then a lot of pain, all different types, chronic, acute, arthritis, kind of the whole gambit.
Wow, so comprehensive.
Yeah.
Truly. So could you tell us a little bit about the cost structure for your treatments?
So it's $75 a session, and each session is an hour. And then I will prescribe herbs sometimes as well, and I try to keep the price as low with those as possible. And it depends. Sometimes it's $15 to $25 for a formula, so it's really not too bad.
Okay.
Yeah.
I understand that in Tennessee, that acupuncture is covered under some insurances. Is that true?
It is, yep. And so we're working with different insurances right now to get that covered. And hopefully it will be growing more and more as we go.
That's great. I've heard specifically for lower back pain, so I think that's really encouraging because I know people suffer.
Definitely.
Yeah. Okay, thank you. So how many treatments do I typically need to start to feel a little bit better?
Yeah, each treatment depends on the person and their condition. So the sooner someone comes to me, the less treatments they typically need. If I'm seeing somebody with chronic pain, oftentimes I'll see them 4 to 6 times to get them feeling better within once a week for those 4 to 6 sessions, and then back it off maybe once a month, or just depending on how they are. If someone is, younger and it's more of an acute injury, I'd see them a few times so they're better, and then they can come back as needed. So it depends on the person. It's a very individualized medicine.
Okay, so that makes me think of something we probably should have talked about before, but what's the assessment situation like? What's our consultation look like?
Yeah, so acupuncture, it's really based on observation. And so because it was developed before we had imaging or blood work, they got really specific with understanding observational diagnosis. And so I'll look at the person's face, at their tongue, the color and the coat and the body of the tongue, as well as different areas where it might have cracks or patches. And then I feel the pulse, and the pulse, there's actually multiple positions on each side, and they have different qualities as well as signs and symptoms. And so I'm really encompassing the whole person, understanding their whole pattern and seeing what's out of balance. And we might look at what is the root of the issue and what is the branch of the issue. And so we treat the branch, get you feeling better right away, but also address the root and help you become more balanced to prevent further issues down the road.
Wow, sign me up.
Yeah.
Lauren Morris, Revitalist, Knoxville, Tennessee. Thank you for being with us.
Thank you.